patellofemoral rehabilitation. So if you have knee pain, it's possibly on the kneecap or just onto the inside of it. It could well be, and again, I'm not saying it is, but it could well be some form of patellofemoral syndrome. We're going to talk about how to rehab it. We're going to look at what it is and what's causing it. We're then going to look at some typical treatments, which for the most part are incomplete, or the way that most people deliver that typical treatment is incomplete. And then we're going to look at some additional parts to the treatment so we can make sure we take some pressure away from the area, so we can essentially rehab that little bit quicker. So what is this knee pain and what is this patellofemoral syndrome? Well, essentially, it's patella maltracking. So this patella which is essentially the kneecap, or which is the kneecap, not essentially, it is the kneecap. It needs to be, in some respects, in the middle of the knee here. What can happen is we can get maltracking, and it could shift ever so slightly to the outside. That's where I want to go. So we can get pain through the inside. So we've got that maltracking. So what's causing it? Obviously, as I've mentioned, the misalignment of the patella. What could be causing that? A valgus knee, which is the knee collapsing inwards. So when you run, when you squat, if your knees collapse inward, it doesn't have to be excessive. It could just be a lot of small valgus knee. And then again, that could be due to hip dysfunction. What that's then going to create is potential imbalances through the medial quads, or the vastus medialis, and the vastus lateralis. So we've got these two muscles that need to help hold in place. And it's very important that I say it's these two muscles that help it. Because in some respects, when we talk about the typical treatment, this is as far as some people go. And what we're going to find out is that this can put excessive pressure through the area, so it's not as effective rehabilitation as it could be. So the typical treatment is to stretch hamstrings, stretch IT band, and then strengthen vastus medialis, which is this little muscle. Well, it continues up through here, but the bit we can see is this little bit here. So what they're essentially saying is if it's being pulled out to here, then this lateralis is too strong, the medialis is too weak, and it's pulling out here. So what we need to do is strengthen it up, and it'll pull it back into position. So from a logical perspective, it sounds pretty sensible. But what we're not addressing is the valgus knee that could be happening and the hip dysfunction that could be happening, because we haven't even gone up here. Some people might say, with regards to the IT band, we need to stretch it. It's very hard to stretch the IT band because it's a bit like a tendon. It's a very fibrous, solid piece of tissue that doesn't stretch very well. But what it does do is it attaches up into glute medius, glute minimus, glute max, tensor fascia lata up at the top here. So if we want to manage what's going on in the IT band, it's much more effective to come up into this area of the hip. Because not only is it going to manage the dysfunction in the hip, it's also going to manage how the knee goes into that valgus position, which is essentially when it bends, it collapses inwards. So we need to be able to add this into the scenario, and we need to move away from just trying to strengthen the vastus medialis, because it's an incomplete treatment, and if it's incomplete, essentially it's ineffective. But what we do see is a lot of people really hammering the vastus medialis, which again can put excessive pressure on the kneecap, which can again create its own problems. So with regards to the additional treatments, as I've mentioned, we need to start focusing on not only glute max, but also glute medius, glute minimus, because we've got the hip extension and the external rotation. So it has fascial connections across the SI joint that transfer load. So that's another important part. Hip extension helps unload the patella tendon. So when we look at that image of the knee, and we've got the quadriceps tendon above, the patella tendon below, we are starting to unload this area. So again, as I mentioned, if we're hammering vastus medialis, then that's going to be creating extra tension on the patella. So, for example, you can see here, we've got knee flexion and hip flexion here. So what's happening as the hips come back, into that position, it's flexing the knee. So we're getting activation through vastus lateralis, vastus medialis. But what we're not getting is the excessive pressure going through the patellar tendon, because the knee is vertical and the hips are back. If we go into more of a squat position, so the knee comes further forward and the body's more upright, in this sort of position, what's basically happening is all the pressure is moving away from the hip and towards the knee, which again is putting this excessive tension on the patella and on the knee and on the structures of the knee, the ligaments, the tendons and the muscles. So what we need to be doing is really focusing on this hip hinging movement, getting the hips back, keeping the shin vertical so we get activation through the quadricep muscles, but then taking the pressure away from the tendon. So again, it's not to say that the traditional treatment is completely irrelevant, because there will be some useful parts to it. But if you're not doing it along with this hip development, so with regards to glute max, so if I just draw one corner or one side of the pelvis very crudely, you obviously have the hip socket here, you'll have the femoral neck, and then the femur coming off here. So we've got glute minimus will sort of come into this position, glute medius will come into this position. So these are two muscles that are going to help stabilize that valgus knee. And what essentially the valgus knee is, if we look at it from the front, it's where the knee collapses in, and then you've obviously got the pelvis there. So the knee's collapsing inward. So these muscles will help maintain that sort of vertical shin. So not only have we got a vertical shin from a side view, we've also got vertical shin from the front view. So we're getting glute minimus, glute medius working in that external rotation of the knee. We're getting glute maximus working with the hip extension. We're taking the pressure off the patella as we go through. So we need to activate this gluteal group using these hip hinging type movements. We can use bridging again to develop these muscles, which again is going to take pressure off the area. So all of these parts will go together to create a much more effective treatment than just doing knee extensions. So again, if we were to go on so if I just sort of crudely again draw a knee extension machine where someone will sit on and they'll sort of have their leg hanging off, it will go around something that they will, like a pad that they will push up. Obviously going all the way through the movement puts a lot of pressure on the kneecap here. If we just do the vastus medialis, which is the top of the movement, it's sort of the top 20%, again, a lot of pressure is going on here. So we've got all this knee extension with nothing from the hip. But if we can get the hip moving more, we're going to be much more effective at keeping the stress away from the knee and onto the hip. So again, there is some value in doing it, but if it's incomplete without all this gluteal work, then it's going to be that much more ineffective. So to be able to rehab that patellofemoral syndrome, we need to be introducing the hip into it and making sure that not only the quads and the hamstrings are strong, but the gluteal group, which is essentially dictating where the knee goes, that is active and doing its job properly. So hopefully that's been helpful. Hopefully it's given you a better idea of potential treatments for your knee. So many thanks for watching. My name is Chris from Chris Pole Training. I'll speak to you in the next tutorial.